Welcome to the MSFS Global Challenges series. My name is Nicole Bibbins Sedaca, and I am the Deputy Director of the MSFS program. Our topic this week is the regional impact of COVID-19. We'll look at three regions: Latin America, Middle East, and East Asia. For Latin America, we'll be joined by Father Matt Carnes, the Director of the Latin American Studies program at Georgetown University, who will be interviewing Pamela Figueroa, an alumna of the School of Foreign Service and a researcher at the University of Santiago de Chile, and a former chief of the Studies Division of the Ministry General Secretariat of the Presidency. For the Middle East, I will be joined by my colleague, Dr. Joseph Sassoon, the Director of the Center for Contemporary Arab Studies at Georgetown University. And we will be sitting down and speaking with Her Royal Highness, Princess Ghida Talal, who is also a BSFS and MSFS alumna and the chairperson of the King Hussein Cancer Foundation and Center. She also serves on the MSFS Board of Advisors. We'll also be joined by Dr. Saad, the Jordanian Minister of Health. And finally, in East Asia, Evan Medeiros, the Penner Family Chair in Asian Studies in the School of Foreign Service, interviews two top Asian thought leaders: Kenichirō Sasae, the former Japanese ambassador to the United States and current president of the Japan Institute of International Affairs, and An Ho-young, the president of the University of North Korean Studies and the former South Korean ambassador to the United States of America. I hope you enjoy our conversations.
So welcome. My name is Father Matthew Carnes, and I'm the director of our Center for Latin American Studies here at Georgetown. And I'm delighted that you can join us today for this conversation, where we have with us Pamela Figueroa. Pamela Figueroa Rubio is a professor at the Universidad de Santiago de Chile, one of the premier universities in Chile. She is a proud graduate of Georgetown's Center for Latin American Studies master's program, and she has her PhD in political and social studies from the Instituto IDEA in the Universidad de Santiago. She has a wide range of expertise, but mainly in democratic governance, institutional design, international relations, and national security. She's taught at several major universities, and we're delighted to have her joining us today. Her applied experience is equally impressive. During the administration of President Michelle Bachelet from 2006 to 2010, Pamela was the top aide to the Undersecretary of the Ministry of the Interior, and then she headed the Division of Internal Security in that same ministry. And then during President Michelle Bachelet's second administration, she was the chief of the Studies Division of the Ministry of the Secretariat of the Presidency. And that was particularly important because Chile has been reevaluating its constitution, and she played a key role in thinking about what that constitution might look like if it were to be redesigned. And most recently, from 2019 to 2020, she's been a member of the Technical Advisory Committee for the redesign of Chile's constitution. So Pamela, wonderful experience that you've had throughout in Chile and really contributing to its governance over these most recent years. Today we get to talk about the COVID crisis and how it's affecting the region. And as you know, and maybe many of our students know, Latin America is now one of the global hotspots, one of those that's most affected by the COVID crisis. Could you speak to us some about how the pandemic has affected Chile, what measures have been put in place, and then maybe put that in the context of Latin America as well?
Okay, well, thank you very much for the invitation. Thank you to Georgetown, to the Center of Latin American Studies. It's a very great pleasure to me to have this conversation. And what about the crisis related to the COVID-19 in Latin America? As you know, now in this time, Latin America and the Americas is the focus of the pandemic. Yeah, it's the region where we have most of infected people, most cases, and a really high rate of deaths. I think that what this pandemic started, most people was thinking about the effects that it would be in Latin America, because Latin America have very structural reasons to worry about. because of income inequality, because of poverty, because of difference in the state capacity in different governments and countries. So I think that the reason why the pandemic is so hard in Latin America is because of the capacity of the state, societies, and the structural problems we have to deal with this kind of problems. Yeah, I know that the pandemic is a global issue, but in Latin America, the effects are worse than in other countries, than in other regions. So I think that we can focus in two special issues about the pandemic. One is the structural reasons, as I say, poverty, income inequality, and other kinds of inequalities, because in Latin America we have another kinds of inequalities, like, you know, gender gap, indigenous people that is most affected because of this kind of problems. We have difference in territories, inside the countries and in different countries. And that is a big issue, the structural, economic and social characteristic of Latin America. And the other issue is the capacity and focus of governments to deal with these kind of problems. And it's not just about, you know, ideology or political parties focus, because governments from the left and governments from the right have different responses in Latin America. Yeah, and I think that in cases where the government had really focused on the role of the states and the protecting population, or having support in economic and social issues, more than, or not just in health issues, that kind of governments deal better than the others with COVID. So, but in countries where the government or leaders think that it's not necessary have a really important role of the state in dealing with the social, economic, and health issues, COVID spread, you know, worse than in other countries. And because of the income inequality in Latin America, the pandemic also started like in the high and middle classes, because that was the people, you know, that had the opportunity to travel outside the region or outside the country, and then spread to more vulnerable or more or poor people. And that's, you know, is the effects on poor people. It was really hard because of the conditions of life that population.
Thank you. That gives us such a really firm overview of some of the deeper structural issues, especially the diverse ways this is occurring in the region. Could you speak a little bit specifically about Chile and how it's been experienced there? You know, who did it affect first, and maybe what policies are in place? I know you mentioned when we first got on that you are all still in lockdown right now. What does lockdown look like in Chile?
Yeah, in Chile, the pandemic started like in March, the second week of March. And in Chile, because we live in the south, March is the month where all the economic and education activities start. Yeah, we have February is vacation for us, and March is the first month of the year. So we were starting classes, and we were starting all the activities of the government when the pandemic affected with the first cases. So the government decided to go to a dynamic lockdown or dynamic quarantine. What that means that some special places of the city, you know, in Santiago, is the main city of the country, we started in the high and middle class levels territories with this quarantine, because the people that was affected live there, yeah? And then the COVID was spread from these territories to around all the city, because people moved to work from the poor populations territories to this kind of municipalidades or communities where live middle class and high class people. So we started with a lockdown in this dynamic lockdown, but the government decided to declare the state of exception. That means that we can move in the night. Yeah, we have the curfew with the estado de excepción with a limited possibility to move at night. So all the country closed at 10 at night until 5 p.m. So it was the first policy of the government. But the focus, it was in the security issues, yeah, this kind of limit the mobility of the population, and the health issues focus on the hospital, yeah. The government decided to support hospital to prepare to receive infected people. But the problem in Chile, it was like, because of the inequality, the social and the income inequality, when the rich people and middle class people was affected, the system, it works well, yeah? Because we have an health system that is, that it has a large part that is public and a small part that is private. So when the middle class people and rich people was affected with the COVID, they can go to the private health system. But when the COVID spread to the poor peoples, the health system collapsed, because, you know, we don't have a necessary support for the poor people. And that's what the moment when the COVID really affected all the country, and the government needs to have to take more measures about this problem. The problem in Chile was that the government decided protect the economy first than the health of the people. President and the ministry of that moment, because then we have the president have to change the Ministry of Health and other ministers. We had two different moments where the government changed this cabinet. In the first moment, the president and the government, that is a right-wing government, decide to protect the economy, because they think that the COVID, it will be like, you know, 1 month, 2 months, and then we can go back to the activity. But I think that measures were not just insufficient, that it was wrong, because they don't see that most of the population in Chile don't have the conditions to have health prevention in, you know, washing the hands, social distance, because people live in a very difficult social condition and economic conditions. So the effect of that, it was that the COVID spread so fast that now the government had to put a total lockdown in the big cities, Santiago, Valparaíso, Concepción, that are the main cities in the country, and that affected the economy worst, because people cannot work, and that increased, you know, the unemployment, and increased the social and economic crisis. And we are still in a lockdown. We are still in a state of emergency, and we don't know when that will change, because the rates of people infected and the rates of deaths are very high in Chile. I see that the wars in Latin America related with the population in the total population, and is a very, and most of the the civil society and most of the opposition leaders and local leaders are very critics that are critics to the government decisions, because they see that the government don't consider the scientific community, for example, to hear like the expert from health policies or social policies. And now we are in a very critical situation in Chile. It's rare, because it's strange, because most of the people think that we have a very strong health system and a very strong economy, but the COVID-19 showed that it's not real. That is very strange, because we have a country now that is so different than the country last year or 2 years ago. That is strange for Chileans, and I think, and I'm sure that is strange for people from other countries, from Latin American or on other countries that see Chile, that is a very, strong country with a strong economy, with a very strong political system. But the reality is not like that now. And I think that is also because last year, on 2019, on October, Chile has a very, great unrest, social protest because of income inequality, because of social justice. And the pandemic and the COVID-19, chose that problems deeper. The economic and social issues in Chile are very deeper.
Yes, thank you. I want to follow up on that a tiny bit, because you mentioned there Chile's somewhat exceptional quality inside of Latin America. And many, sort of the back of the envelope summary for Chile that people often think of is after emerging from the dictatorship and returning to democracy, a foundation had been really set by Pinochet that was very free market. And many people will say this led to lots of growth over a sustained period. And that made Chile something of a regional leader, and other Latin Americans looked at Chile sometimes enviously for that growth. But when you scratch the surface of that growth, you see that it was very inequitable. And in fact, the inequality was growing throughout almost that entire period. And there was this sort of pent up social demand. And a lot of us scratched our heads for a long time and said, will we ever see protest around this? Will we ever see mobilization? Well, October of last year, October of 2019, wow, that exploded. And you saw people on the streets, you saw protests over changes in the cost of some social programs. You saw the burning of subway cars. There was this mass mobilization. And then actually the use of military on the streets for a fairly short period, and widely criticized inside Chilean society as well. So there is this sort of pent up demand there, social demand for change. But some analysts worry that now with the pandemic, then people are forced to stay home, it's harder to organize, and there could even be, in some throughout the region, worry that this could lead to a return of more authoritarian tendencies, both in Latin America and around the globe. How do you see the pandemic affecting social protest, the means the government uses to govern? Are you concerned about how this will affect Chilean democracy?
Yeah, I really concerned with this situation for two issues specifically. In the issue of social protest, I think that people, because of the lockdown and because of the social distance, people stay home. People cannot participate in the public manifestations, but people found another ways to protest. For example, every time that governments take a decision that is different that people expect, people protest from their homes with the pots. Yeah, we have a very special kind of protest that is,
Cacerolazo.
Cacerolazo. That is a very expanded kind of social protest, and this is amazing because, for example, last week we have the president had his discourse in the Congress about the state of the government, and all the people in the country was taking pots for the cacerolazo. So social protest has new forms of express. And also in some regions where we don't have a lockdown, or because the COVID is lower than in other regions, people take the streets to protest, to unrest. So that was in the south of the country, where in the last week we also have protests of the indigenous people, and a very worried issue about racism, people against Mapuche people in the streets with a lot of violence. That is new in Chile, and I think it's a new issue to worry about democracy. We can talk more about that after, but about the social protests. So I think that because of the lockdown and because of the COVID, people stay home for now. But the reasons because of people protest on October 2019, I think that today are more visible, are more present in all the society than 6 months ago. I think that now the Chilean society have a consensus that is necessary. It is a very necessary a change of the model. It's not just some social policies, and I think that now the Chilean people are very conscious that the social model and the economic model that we have for the last 30 or 40 years is not enough to deal with the main social and economic problems in the country. And we say now that Chile now looks more like Latin America than we thought. Yeah, Chile is not a country so different from other countries in Latin America. I see that the transition to democracy in the 1990s, it was a very important process in Chile, because I think we work well with the transition to democracy. We have a very pacific transition. We diminished poverty. We have a very stable democracy. But from 2000 to now, 20 years, yeah, that specific model of democracy with a liberal economy is not enough to deal with issues like inequality, income inequality, inclusion of the new groups that needs to be here in democracy, because we still have a democracy that works well, but is elitist. Some people can reach representation in the political system, but a lot of people feel that they are not represented in the government, in the parliament. So the legitimacy of the system is in question. Yeah, and the confidence of the citizens in the government and the main institution, not just the government, also in other institutions like police, armed forces, the economy, the church, and every institution in Chile is questioned now. So I think that the Chile, because it looks more like that Latin American with like other countries with Latin America, have this instability, this crisis now that is so clear now with the pandemic. So I'm sure that when the lockdown ends, people go to the streets again to demand social justice, to demand a better democracy. But I think that also people in Chile, and I think that in most of Latin America, people want a pacific change, graduate a pacific change to another political and economic system with a deeper democracy, with more social justice, and with more peace also, because violence is an issue in the region that is emerging again, and I think that we have to put a focus on that. You asked me about my worry about democracy and authoritarianism, and I think that we must be worried about that. Why? Because in all Latin America and also in Chile, some kinds of authoritarian culture has keeping in like underground, yeah? We all seen that we have a cycle of democracy and liberal economy that is good for Chile and for most of the countries in the last 30 years, but some kind of authoritarian culture stay on all the time. For example, we have a change of cabinet in Chile. The president changed some ministries and important ministries in the government last week because all the pressure from the opposition and the social movements because of the government decisions about COVID and social and economic policies to protect the people that lost employment and everything. And the president decided to nominate a ministry of the interior that is the ministry focused on the public order and security, who was a person that had a role in the Pinochet government. Yeah, he was a mayor designed by Pinochet. So it's a very provocative, decision. When you have social protest, when you have unrest, when the society is demanding more participation and a better social policies and a democracy more inclusive, if the president nominates a person who has related with the dictatorship with Pinochet, the result of that is, like more unconfidence of the government. And because of that, we have this issue in the south of the country with Mapuche people demanding justice, demanding inclusion in the debate, and the Ministry of Interior went to Araucanía and had a very hard speech about public order, about control the protests, so that increased the violence. So it's like a cycle. It's like a cycle when you take decisions to strengthen the control and the security issues. Social movements like the indigenous movements feel like threats for that decision that looks less democratic or more authoritarian. So we have that kind of issues, you know, puts the democracy and the rule of law in question. That is Chile now.
Yes, no, and thank you for, I especially appreciate you highlighting the way this has affected the Mapuche, the indigenous people in the southern part of Chile. And I'd like to come back to that in a moment. But I wanted to ask you for a moment, if you would, give us a bit more regional perspective and maybe just comment on, you know, a couple of countries, the ones that most appeal to you, but one that immediately comes to mind in response to what you were just mentioning is Brazil with President Bolsonaro. Because you mentioned, you know, tendencies of centralizing power and memorializing or celebrating the military dictatorship there, which is something a few times he's done, which has raised lots of concerns in Brazil. And of course, Brazil is the global hotspot, you know, with just almost unbridled numbers of new cases and deaths there. He himself has had the disease. When you look around the region, how do you see, and you mentioned Chile is seeing itself much more as being like the region, like Latin America, you know, whether it's Brazil or Colombia or Mexico that you maybe want to speak about, but just a little bit about how the region also has been experiencing the pandemic and maybe its effects on democracy.
Yeah, bueno, Latin America is a diverse region. We have, you know, diverse experience. You can see the South region is different from Mexico or different from Central America, but we have some problems for all the region that are the same: inequality, poverty, corruption, violence. I think that all are the main issues in Latin America. The difference are the deeper of the problem and also the response of the government. I think that those characteristics are special. But I think that now the crisis of democracy affects all the Latin America, but in different ways. Yeah, for example, you say Brazil. Yeah, Brazil is strange because after a long time of the government from the Partido de los Trabajadores, is more like a popular government. Brazilians decide to elect a very authoritarian leader like Bolsonaro. Bolsonaro has a authoritarian speech in his campaign and also now in the government. And that is that affects other countries and regions in Latin America, because Bolsonaro is a president of a very important country, not just in South America, but in Latin America. And he tried to put the issues in Latin America to confront different models of development. And he tries, for example, to have some common issues with Chile, with Colombia, with the governments that are on the right, yeah? And that is one kind of political examples in Latin America of the authoritarian leaders, yeah? But we have other examples. Bolivia, yeah? In Bolivia, we had a presidential crisis last year. President, you know, left the government, and and they have a special a transition, yeah, that have in focus have new elections. But the interim president, because of the COVID, but I think that because of she has to keep the power, he decided to suspend elections. Yeah, the reason it was COVID, yeah, or the public reason it was COVID. But if we see that other countries have elections in the pandemic, like, you know, República Dominicana, Dominican Republic, or countries in other regions like Korea and others.
Or even the United States.
Yeah, in the United States, there is no, you know, real reason to suspend elections. So we must be worried about that kind of issues about democracy in Latin America. Suspend elections because of COVID, I think that is not a reason, it's a real reason to suspend elections. And I think that all the international community must support to have election in the region to respect democracy. So we have Brazil, we have that kind of problems in Bolivia, for example. But also we have other kinds of leadership like Mexico. Yeah, the president AMLO, the President López Obrador, it was, you know, like the first president of the left that was elected after a cycle of government of right, Brazil, Chile, Colombia, etc. So most of people was looking Mexico to see what's it's gonna be a new cycle of left leadership in Latin America. But the President López Obrador, it was very conservative in the relationship with the United States, in the social policies, in the reaction with the COVID. So also in Mexico, some people is worried about what is going on with this president that has a political program in the campaign with a focusing social policies and a different way of government. But when get the power, his policies are like different than what he said in the campaign. So that's other kind of problems of democracy, because, you know, when the people elect a government, have the expectation that that government have policies related with his political program in the campaign. So I think that democracy in Latin America is in a critical time, because most of civil society, most of people feel that the region need a new cycle of reforms, a new cycle of political reforms, a new cycle of social and economic reforms. Since 1980 and 1990, Latin America started a cycle of liberal economy, yeah, that they started with the Washington Consensus. And then from 1990, we start a cycle of representative democracy. That it was, that it worked. I think that it was a good cycle. But in the last 10 or maybe 20 years, that political economic model seems like insufficient to deal with important issues in the region, like inequality and violence, I think now. So we need to start to think about changes in the political, economic, and social issues and social model. And that means to strengthen democracy and to strengthen social policies to deal with inequality. I think that inequality, for many long time, it looks like it was a problem that had no solution. Yeah, that we say Latin America have inequalities, but the reality now shows that we can have a strong democracy if we have social incomes and different kind of inequality. Democracy needs a social and economic structure with more social justice, because we can reach the social peace with this high level of inequalities. And as I say, it's not just income inequality, it's other kind of inequalities. For example, gender inequalities, indigenous people role in the society, all kind of minorities that have no representation in the system. So, you know, democracy. Yeah, Latin America is a very diverse region.
It certainly is. Could you say a little bit more about the point you raised right there at the end about those populations that have been, most affected, often the more vulnerable populations, both the way they've been affected by COVID, but maybe the way that's exacerbated the situation they've already been facing. And so indigenous peoples, Afro-descendant communities, the LGBTQ community, women, quite notably. How has the pandemic affected them? We see in the United States, those are often the groups that are most affected. Has that been true in Latin America? And how have they been responding?
Yeah, I think that vulnerable people, like the group that you talk about, indigenous people, women, different kind of minorities, are most the impact of the pandemic is a very high impact. Why? Because the structural conditions that kind of population have in the society. Latin America is a region with, as we know, with high inequalities. That inequalities means that the people most vulnerable when we have crisis, economic crisis, political crisis, and now this pandemic, this health crisis, this kind of people have less support to deal with the problem. Yeah, they don't have, for example, state protections. The economies in Latin America are very related to the employment, to the quality of the employment. We have a lot of people with informal employment. So we have crisis. They lost all income. They lost not just the employment, that they don't have, where to receive money to eat, to satisfy the basic necessities. So, for example, the indigenous people that also in Latin America, we have, the indigenous people in Latin America is more present in some countries, but they are present in all the countries. Yeah, for example, if we see in Bolivia, Peru, Brazil, or Mexico, there is a lot of, or Central America, there are more indigenous population. In countries like Chile, Argentina, are less indigenous people, but but we have that communities. Because of they don't have special protections with this kind of health crisis, they are more affected because we don't have a social system, public policies, or special decisions from the government to protect them. We can see that on Brazil, we can see that on Central America, and we can see that on countries like Chile, where indigenous people is poorest than the middle of the population. and they don't have the necessary social protection from the state to deal with this problem. So women are also more affected because most of women in Latin America depend on informal employment. So when we have a crisis like this that affect the economy, the first people that lost the employment are women. They don't have social protection. In Latin America, and especially in countries like Chile, the social security system is more like private system. It depends on the individual history of work. We don't have a social system, a social security system from the state. So women are more exposed to this kind of effects of the economic and social crisis because of the COVID-19. So all the minorities in Latin America are more affected with this kind of crisis. And the people who resist better the crisis are people who have more access to social support than other, and that is a very small amount of population.
Thank you. And I know we're getting towards the end of our time here, so maybe just one final question. It would be, what opportunities do you think the pandemic might be opening up? You know, if it's exposed some of the fundamental divisions of society, some of the fundamental shortcomings of the democratic model or the liberal economic model, what sort of opportunities do you think are being opened up? What might the region look like if it seizes those opportunities?
Yeah, actually, I'm optimistic because of this crisis. I am optimistic because I think that the crisis show the region as it is, show the inequalities, show the poverties, but also shows the solidarity in the population, the idea of community, the identity of the Latin Americans. And I think that this crisis is an opportunity to look for a different way of doing things, for in a way of cooperation. We can find a new economic model. We can strengthen our democracies through the social participation, through new mechanisms, from new mechanisms of participation in the democracy, in the institutions. So I think that the opportunity of this crisis is look inside Latin America and understand that we need each others. We need also strength the international relations, the multilateralism, so we can find new opportunities to diminish inequality, to strengthen democracy, to have better relations in our communities and in international relations. And we can also, you know, have better relations with all the inter-American systems. In the last, in this week, for example, we were talking about the election of the president of the Inter-American Bank. And that's is a very good conversation in Latin America, because it's an opportunity to think about the model of development that we want to have in the future. The model of democracy that we need in the future. And I think that it's a very great opportunity to think about a better society, a society with more social justice, with a democracy that include all the people, that are more participatory, but with better mechanism of participation and deliberation from the people.
Thank you. Thank you for this conversation. And I appreciate where we ended up there, which is really about increasing participation, increasing and stretching bonds across divisions in society, something which you've been working on for so very long in your own work, in the constitutional reform there in Chile and the presidency of Michelle Bachelet. So thank you for sharing your experience with us today. Thank you for sharing these great insights. We are very pleased and proud to call you a Hoya, a graduate of Georgetown, and we're so proud of the work you've done. So thank you so much for joining us today.
Thank you, Matt, for the invitation. My time in Georgetown, it was very important to me, so I'm very happy to have this conversation with you and with all the Georgetown community.
Thank you.
Welcome to our conversation today about the regional impact of COVID-19 and the pandemic on various regions in the world. Today, our conversation is about the Middle East. I'm delighted to be joined by my colleague, Dr. Sassoon, who's the director of the Center for Contemporary Arab Studies at the Walsh School of Foreign Service at Georgetown University. He's a professor of history and political economy at the center and holds the Al-Sabah Chair in Politics and Political Economy of the Arab World. Thank you, Joseph, for being here and for taking to introduce our two guests.
Thank you. So I have the pleasure to introduce our two guests. First, Her Royal Highness Princess Ghida Talal serves as the chairperson of the King Hussein Cancer Foundation and Center, which is based in Amman. She is an alumna of Georgetown University's joint degree, the BSFS and the MSFS program, and serves on the MSFS Board of Advisors. Dr. Saad Jaber, Minister of Health, and before becoming a minister, he was a cardiovascular surgeon with the Jordanian Royal Medical Services. For both of you, thank you very much for joining us and welcome.
Thank you very much for hosting us.
Thanks. Yes. Your Royal Highness, let's start with you. It is wonderful to have an alumna here to speak with us today, and we look forward to welcoming you and the minister to campus at some point when we're all able to travel again. If you could share with me, Your Royal Highness, your thoughts about Jordan's response to the pandemic since this pandemic overtook all of our countries.
Sure. Thank you, Nicole, and good afternoon from Jordan. I'm extremely happy to be here with you today and with Joseph, Professor Sassoon. Yes, I am a Georgetown alum, and so is my husband. My 3 kids are currently Hoyas at Georgetown. And of course, the star Hoya is His Majesty and the Crown Prince. So Jordan is a very big Georgetown family. So I'm really happy to be here, to be having this conversation that will be shared with the incredible MSFS student community. For me, the best place to start is with a famous saying by our beloved late King Hussein, who always said that the people of Jordan are its most valuable asset. And this is really reflected in every action taken by King Abdullah and the Jordanian government in the face of the COVID pandemic. Because as Jordan was faced with difficult choices, His Majesty placed the health of the Jordanians as his first priority, knowing that Jordan would, of course, incur crippling economic losses. So really, from the first signs of the outbreak, drastic measures were taken, a very strict lockdown and curfew that were some of the world's strictest. And thank God, we were largely successful and witnessed minimal spread of the disease in the country. Now, of course, as the whole world is experiencing case numbers rising, so are we in Jordan, albeit at a minimal pace. And of course, who better than Jordan's Minister of Health, who has worked round the clock with his team to contain the spread of the disease. And I think he is really the person most fitted to answer this question.
Thank you.
Thank you. Mr. Minister, if you could provide an overview of what the response in Jordan looked like, how it was implemented.
Well, we had an eye on what was happening in China very early in January. And at that time, it was more or less stressful seeing people in China dying, and some reports showing people, this kind of disease unknown to us at that time by the end of December. So in January, actually, we started to think about it and what will happen if it becomes a pandemic. So at that time, we gathered, as government and as influential people, and we raised a plan to the government that we have to put a strategy to protect the Jordanian people. And His Majesty the King gave us the green light to take any measure that might help protect Jordanians. So by the 24th of January, we gathered the National Committee for Infection Control, which represents the whole spectrum of health sector in Jordan. In Jordan, we are a little bit fragmented in the health sector. We have the governmental, the military, the private, and the university hospitals, and Al-Hussein Cancer Foundation. All of them are separate, but in general, we work together through committees. So we gathered the National Committee for Infection Control on the 24th of January. At that time, we decided to put thermal sensors at the airport. So because the early reports from China said, that rising temperature was one of the earliest signs of this disease. On the 2nd of February, we banned travel to China. And that was a huge step because we have, economic ties with China. A lot of goods comes and goes to that country. And it was for us to see what we have. So we put our strategic goal to protect the people, to prevent the disease from coming to Jordan. And we started to put plans if the disease enter Jordan, what we have to do. So we have to know our capabilities. Our capabilities at that time were minimal. We didn't have PPEs. We didn't have isolation ICUs or hospital. We didn't have quarantine areas. We didn't have anything. So we started to check what we have, and we had minimal PPEs, minimal areas for isolation, and minimal places for quarantine. So we started working day and night. We were able to build or renovate a hospital to be a quarantine place, which was capable of putting at least 400 people in quarantine. And we started to put isolation ICU and increasing our critical care areas places. Also, we found that we didn't have enough masks. And so what we have to do, we asked from the other countries to send, but we found that China was buying all masks and PPEs from the world. So we started putting plan to manufacture them. So by the 15th of February, we started making masks. And on the 16th of February, banned travel to South Korea, which was witnessing increasing numbers of affected people. And on the 24th of February, we banned travel to Italy and Lebanon at that time, because Lebanon showed increased cases coming from Iran, which showed huge number of cases by that time. We didn't have direct flights or contact with Iran. So Lebanon was banned, Italy, which made us a big issue because it annoyed the European Union as whole, because they are sort of one unity, and we have a lot of relations with Italy. you know, women like to go shopping and take, you know, I didn't know that hundreds or thousands of Jordanians were in Italy at that time, and they had trouble coming back, you know, fashion things and so on. So everyone coming from Italy has to be quarantined, and it was hundreds of people at that time. We had increased our ICU capabilities and quarantine area. Also, by the end of February, we started constructing special quarantine area by the Dead Sea, which is the lowest place on Earth. It's 400 meters below sea level, assuming that that place has higher oxygen concentration, and we were able to put more than 2,000 prefabs, each one 2,000 units. Each unit has its own room and capability and healthcare services. By the 1st of March, we had the first case of corona coming from Italy. And at that time, we were kind of prepared. During the whole month of February, we conducted 490 courses training our health personnel on how to deal with suspected cases and proved cases. And this helped us that the first case coming, we dealt with it, and on the 5th or 7th of March, we banned travel to Germany, Spain, and France. Being effective 5 days later, but on the 15th of March, we decided, the government, we decided to quarantine everyone coming to Jordan, and we put Jordanians coming from other countries in 5-star hotels. We were able to put them there, which decreased the social and public annoyance by that. And on the 17th of March, we put the strictest, the most strict measures by putting a nationwide curfew, and everyone had to stay, and we had to learn. I mean, it's the first time of Jordan happening that, so we have to learn how to learn how to balance between health and economy, because you know people need goods, needs food, you know, some economic facilities they can't close at all. I mean, like I don't know. Egg farms or huge factories, you need 1 month to close the factory or something like that. So we had to exercise. By that time, His Majesty the King was supporting us fully, and we announced and started to work at the crisis center, which is a fascinating center which gather all people involved in a crisis in one place, having all the facilities to work together, planning and getting all the information which can be analyzed and processed so that taking decisions can be taken quickly. Meanwhile, we were cooperating and having good communication with the World Health Organizations, the CDC in United States and the ECDC in Europe, trying to get information from others. By the 1st of April, I mean, or by the 3rd of April, we started to ease our curfew slowly, which took us till the 1st of June, where we got back to a normal economic function. But meanwhile, we allowed external trade by trucks through the borders, and we continued repatriating Jordanians from abroad, because a lot of Jordanians were abroad. We, since the 20th of April, we were able to repatriate more than 35,000 Jordanians, putting them in hotels and in quarantine area for 14 days. Meanwhile, we started using technology, like making IT solutions for tracking people. We increased our teams for tracking, testing. By the end of May, we were able to start exporting PPEs. We didn't have any factory on February, and on May, we were able to start exporting PPEs to neighboring countries or even donating some to our friends, like in the United States, Kosovo, or Germany, or whatever, our friends. Meanwhile, our knowledge, our capability in dealing with the patients was better, were better, but by the early August, we started to notice some increase in the local cases, and that was because the huge influx of Jordanians who've lost their jobs worldwide and had to be repatriated, and the increased trading with the neighboring countries who needed a lot of goods coming from Jordan or transit. So we are trying now to contain the numbers. Okay, our numbers are 30, 40 per day now, but to Jordanian, which was, near zero for 3 months, is something new and disturbing. The whole government, and security forces are working day and night. His Majesty the King, almost twice a week, meets with us, is briefed about the situation, supports our measures. We are trying hard to keep our numbers as low as we can nowadays. Thank you very much.
Thank you.
Thank you very much for this excellent and detailed response. I just want to turn to a different aspect of the pandemic. How do you anticipate that this pandemic will likely alter the political landscape based on what you have seen in the region in the last 5-6 months?
Well, I'm not a politician, I'm a surgeon. Maybe I'm not the one to be asked this question, but I'll tell you my personal opinion. Well, the first thing we face is that each country has to be self-sufficient, either in its production, because the world trade system has been blocked. So each country has to look to be self-sufficient, either in medical supply or even in food, because you need some goods coming from other continents many times, and you have to export a lot of your goods. Also, the other thing is that the need to cooperate with other nations. For the first time, we noticed, or we know, that something happening in another country, maybe half the way across the world, will affect you. So international cooperation at this stage was very important, but also to strengthen your health system and to be self-sufficient was very critical and important. So the balance between these two was very important. So literally we tried to improve our supply to be self-sufficient and help our people either in the production of medications, PPEs, improve our health facilities. But on the other hand, we had to cooperate with the rest of the world and other countries closely, either in the form of improving or making the vaccine or changing knowledge. Now, what we know in a region like the Middle East, things has calmed down a little bit with this pandemic. So I hope things will even be better in the future.
Okay, what I would like to say, Joseph, is that it's clear that the COVID pandemic is the greatest global crisis of this century, threatening 7.8 billion people. So of course it is bound to have serious political ramifications. Our king addressed this in an op-ed he wrote in the Washington Post. And he pointed out something that that I find quite incredible, that I would like to share with you, that for the first time in human memory, every world leader has the same item at the top of his agenda, which is quite incredible. And you would think that because of that, that would prompt governments to cooperate and coordinate, but no, instead, all of us turned inward, reinforcing basically a trend of retreat from globalization. And in the COVID era, we're seeing a world that is less open, less prosperous, and less free. And this has come as a result of a lethal combination of a deadly virus, of course, inadequate planning, and in some cases, incompetence. But when we're talking about the Middle East, our part of the world, I personally see it that way. We've seen that COVID has completely rearranged political priorities in the region. And issues that were on top of the agenda suddenly tumbled down the ladder. So I'm thinking, for example, of the tragedies in Yemen and Syria. I'm thinking of a nascent revolution in Lebanon. I'm thinking of the ongoing regional struggles in Iran. And these issues have not evaporated into thin air. They're still here and they're still ongoing. But if they remain eclipsed by COVID, we have no hope of seeing any breakthrough. So without any serious progress, today's regional challenges can truly begin to amount to catastrophes. This is how I see it.
Thank you.
Thank you for that. That leads well into my next question and paints a picture of the challenges the region is facing, as you say, that have not gone away, even though another issue has eclipsed them. For both of you, what have you seen? What has been the impact of trust in the global system, in the United Nations, in the World Health Organization, in regional organizations, and just in the leadership that we have, as you're looking at it from the Jordanian level, but also across the Middle East? What has been that impact of trust on our global system?
Your Highness, would you like to answer?
Sure, I'll start it, Dr. Jaber, and then if you'd like to, I will just say that you may know that Jordan has sheltered the largest community of Palestinian refugees for decades now, and currently hosts the second largest population of Syrian refugees. So we have always been grateful, immensely grateful for the support received from the international community to help us shoulder that burden over the years. And over time, of course, Jordan has forged very close and critical ties with UN agencies, governments, and leading NGOs. But however, when it came to the COVID crisis, as His Excellency was mentioning earlier, Jordan's response was a unique and singular one. To just put this in perspective, when the CDC officially recommended that everybody wears masks in public spaces, Jordan's strict lockdown had already been in place for almost 3 weeks. So in this particular crisis, we took our own cues and by and large acted independently of the international community.
Interesting.
Bye-bye, Dr. Jaber, if you...
Yeah, well, regarding the trust of the people, this is what I understood, yeah?
Yeah, the trust in the international system.
Yes, okay. Right from the start, we focused on being as open and transparent as we could. This was the first time we faced something like this. We didn't know all the answers. So it was a very difficult position. We were in a very difficult position, and not only for the government of Jordan, but for all the governments, all the world. Nobody knew exactly what to do. There was no textbook on the shelf to take, or SOPs, and take them and implement them. So we decided early from the start to be transparent. We know that we had to show vulnerability as a government, and we have to be transparent. So we had daily briefing from mid-March till the end, or till 1 month ago, telling the daily cases and any new decisions regarding the people. And we had the courage to say sorry or to ask forgiveness when we make mistakes. Because, I mean, we took hundreds of decisions daily regarding curfew or mobilizing people or whatever. So we had the courage to say sorry sometimes. And this gave a big trust. I mean, people trusted the governmental announcements. And we were the only reliable source of information. I mean, our media, the governmental media, which indicated that they are trusting us. And we try to continue, or we continue to do so till now. We know we are facing very harsh and difficult decisions for the time being, like school opening, going back to school. I mean, balancing. So we talk to the people honestly and as much as we can, showing them the importance of going to school and what measures we have to take to prevent the spread of the disease. Regarding trust in international organizations like the United Nations and the World Health Organization, I think there has been good trust in World Health Organization. Regarding the trust in the United Nations, that our information is that Jordanians have 50-50 trust in that organization. But World Health Organization was one of our main sources of information, and we had very strong relation with them. People in Jordan started to trust very much the CDC in the United States, because our communications with them was based purely on scientific issues, and it was a very trustful source of information. So the trust of Jordanian people was very good with the government and respectful international organizations. However, we started to face, through the media, social media, those rumors about the conspiracy theory. It has affected a lot of Jordanians late in our dealing with the disease. Like it's not a true disease, it's something has been made, and this has affected the compliance of the people, because even intellectuals in Jordan some of them were convinced with these myths and were, just talking to and fro, back and fro about these issues, which has little bit, or to some extent, lessened the trust of people in our measures, or even in the existence of the disease. For some time, we struggled to convince Jordanians that coronavirus disease is existing, because for a couple of months, Jordanians didn't have any case. So they were questioning, is there any disease? Or so we had repeatedly, and His Majesty the King showing that the slackening of people attitude, has to prompt us to go into another campaign to convince them to be compliant with the health measures to prevent the spread of the disease.
Thank you very much. This actually also leads to my question about how has the pandemic impacted the populations that were already vulnerable prior to the outbreak, and what will be the long-term impact on these populations, particularly given what Princess Ghida has mentioned, that Jordan has been extremely generous in opening its doors for refugees in the last 7 decades. But I guess the vulnerable, it's not only refugees, but also within the local population.
Your Highness?
Shall I start? Sure. Thank you, Joseph. It's a very poignant question, actually. I'd like to say here that vulnerability, especially in the face of COVID, can take different forms. It can take the form of medical vulnerability. It can take the form of political vulnerability. Now, in terms of medical vulnerability, I can speak as chairperson of the King Hussein Cancer Center, as I am deeply familiar with the medically vulnerable population, that of cancer patients, who are already immunocompromised and at even greater risk in the context of COVID. And then, as Joseph mentioned so correctly, another highly vulnerable population is the population of refugees. And most recently, the 1 million plus Syrian refugees in Jordan, who are housed in overcrowded quarters, of course, and therefore, as we know, it's a huge COVID risk, no social distancing there, and with minimal access to resources and health services. Because we're not just speaking about Jordan, we're also speaking about the region. You know, I have to mention Lebanon and the tragedy unfolding there. Lebanon was already vulnerable prior to this horrific explosion and was one of the few first countries in the region to really suffer from the virus. So the explosion exposed the dysfunction and the absence of the Lebanese government, and it further endangered an already highly vulnerable population. So truthfully, you mentioned briefly the outcome or the long-term impact. You know, for me, the long-term impact is simply unimaginable. I find it is impossible to project the magnitude of the toll taken by COVID, or continues to be taken by COVID, in even the best prepared populations, let alone in those highly vulnerable groups.
Thank you.
Should I?
Please.
Please.
Well, we were looking at the cases affected in Jordan, and there has been no particular place where vulnerable people had more cases than other areas in Jordan. Actually, the refugee camps were one of the areas where we stressed that we don't want cases there. So we put strict measures to protect them by many things, like doing a lot of seminars to them to help them. You know, the sanitation there does not allow them to have social distancing and so on. We increased our medical staff, and we opened more than 3-4 hospitals or health facilities in each camp to help them. We conducted testing, and they were the only place in Jordan where we conducted even serological tests, not only PCR tests, which are the standard in Jordan, but we tested even serologically to see if they have been infected and cured without knowing. There has been no outbreak in any refugee camp, which indicated that our measures were effective. We tried our best to prevent people from outside to enter to the camps without being tested. We stressed, because we knew that any cases, any outbreak in any one of the camps will be disastrous to us and to them. We even put intensive care facilities close to them, mobile hospitals. His Majesty the King ordered me to build Jordanian-made mobile hospital with critical care facilities to be close to the camps, so that, they have to be treated as any Jordanian. Human lives to Jordan is very important, very critical. I myself participated in 4 peacekeeping missions one of them with the United Nations, and 3 of them with the Jordanian army, where I am honored to have served. Even the governmental hospitals. We had 35 missions in 35 countries, humanitarian missions. I mean, we ran to help our brothers and friends in Lebanon. We helped our friends in Iraq. We helped other Western countries, and even in the East. We believe that we are part of the world. It's a mission the Hashemite family carry, and we carry that. We are humane, I mean, and we help everyone in need. So the vulnerable people, not only in the refugee camps, we have, you know, Jordan is suffering from economic crisis because of the regional things. So the government was able to deliver, I mean, monthly payment for vulnerable and poor families in Jordan for everyone. Even workers had to take their payments. We were able not to lay off any worker in Jordan during this crisis. And that was, or even help financial institutions, factories, to keep their workers by law. So we worked hard for the vulnerable people, the daily workers, employees. Actually, I mean, the rate of unemployment increased little bit in Jordan during this crisis. And that was by the donation. The people, I mean, of Jordan gathered together and they donated money to help the vulnerable. And the government said everyone has to take his payment despite our financial hardships. So summing all this, I am proud that we stood together to help the vulnerable. I mean, I remember the Prime Minister saying, we are different from other people. We will not allow the strong to survive. We will gather the strong people to help the vulnerable. This is the message of Jordan. Thank you.
Thank you.
That's an admirable message, which I hope is carried out to all of the countries in the world, because I think that is what we need at this point, given how impactful this crisis has been. Let me just ask
Mind if I add one thing to what,
no, please,
to what
please.
I was saying? As you know, I'm Lebanese by origin. So my family is in Lebanon. I was in Lebanon during the explosion. It was beyond horrific. It continues to be beyond horrific. But I'm saying this to say that that Jordan, truly under the direct orders of His Majesty, was one of the very, very first country to immediately, number one, on a symbolic basis, lower the flags in mourning of the entire country, in solidarity with the people of Lebanon, and of course then sent a field hospital, a military field hospital, and all kinds of support. I just wanted to say that because at a time when a people is, you know, when the Lebanese felt truly at their very, very lowest, Jordan was one of the very first country that stood by them on a humanitarian level.
Thank you for sharing that. Let me just ask one final question. As hard as this crisis has been for every country in the world, we have also seen some opportunities emerge, or we have learned lessons that have given us opportunities to look differently at the world as we move forward to hopefully soon a post-pandemic world. What do you see as the opportunities that are coming out for the region or for your country specifically? What are those opportunities that have emerged from the pandemic that have given us some unexpected hope or unexpected opportunities to take advantage of going forward?
Okay.
Your Highness, would you like to answer or should I do?
We can, I think, both say a final word since it's the final question. I believe that in every situation, there are opportunities and there are challenges. In this case, in this COVID era, in terms of opportunities, we have seen during the pandemic a remarkable mindset shift across the world, and of course here in Jordan as well. And this mindset shift has been marked by what I call a greater mental flexibility and agility amongst the public. And it has resulted in significant behavioral changes. So, for example, just look at the digital transformation that has occurred. In Jordan, we were transitioning online for a while. It had been a priority for the country and a need for the country, but it was the pandemic and the lockdown which truly forced the issue. At the King Hussein Cancer Center, I'll give you a direct example. We started relying on telemedicine and on virtual clinics, amongst many other things, in order to lessen the exposure to cancer patients and healthcare workers. And all this happened because of the COVID era. But as I said, there are challenges. And the two challenges that I would really like to speak about very briefly. One of the major challenges caused by COVID that not many think about is the distraction of the global community away from tackling other urgent diseases and relegating them to the sidelines. I'm thinking, of course, about non-communicable diseases or NCDs. What are non-communicable diseases? They are comprised of cancer, heart disease, diabetes, and respiratory illnesses. Alone, those four kill 41 million people every single year around the globe. So I'm not saying, of course, not to concentrate on COVID, but if we keep putting COVID first, this is going to result in enormous setbacks in the progress made against all these other diseases. Another thing that I wanted to say, of course, as we speak, Nicole, right now, the whole world is waiting for a vaccine. But in my part of the world, I believe that the main challenge is not only the discovery of the vaccine, but more importantly, ensuring effective access to that vaccine. The accessibility gap between the developed and developing world is lethal and is persistent because it often means that surviving a curable illness is a fluke of geography. It depends where you are born. So my really last word is that I believe very strongly that it must be an international priority to ensure that developing countries are not denied nor delayed access to a vaccine when one emerges.
Excellent, excellent. Minister Jaber, would you like to offer some final words on opportunities and challenges as well?
Well, Her Royal Highness said it all, but I would like to say that during this pandemic, curfew, closure, stresses that we faced, we discovered that we Jordanians are capable of doing a lot of things. We opened more than 500 new factories producing consumables, medical stuff, and so on. Things we used to take as granted and easily to access from any other country now were far behind us, and we have to manufacture it. And it was easy, actually, if we concentrate on that. We strive towards technology, IT. We put IT solutions to track people, solutions for e-learning and going to the universities, a lot of things building new hospitals, isolation rooms, constructing hospitals, speeding up things, which usually take years. I mean, we finished 3 major hospitals within those 5 months, and we are constructing another 2, I mean, which I will receive, I mean, the Minister of Health in November. So, I mean, this has triggered or accelerated processes used to take by bureaucracy years. So this has taught us that we can speed up things. Also, we usually used to work as government or officials in the same context, I mean, not horizontal. Now we had to take and to work with customs, security forces, Ministry of Agriculture, Foreign Affairs. I mean, I had to deal with the Minister of Foreign Affairs because a lot of diplomats used to go and come in and to learn things. We learned how to work together in a more in harmony rather than sending letters or text and waiting for reply. Now we opened the phone. We used electronic communication, which speeds up. And these opportunities taught us that we can do things in a better, faster way and achieve your goal if you insist on that. And this, a lot of things, we have many lessons we have learned from this pandemic. Challenges. As Her Royal Highness said, we shouldn't look only for this corona. There are many other issues like poverty, refugees, regional wars, and most importantly, other killing diseases in Jordan. Luckily, we are taking care of them, but nobody looks at what we are doing with this because everyone is focused on the corona issue. We are trying our best to look for that. So now, in the coming future, we have to look at the vaccine. I think we are dealing with everyone, and today I signed the agreement with the COVAX. If you know what's that, it's the International Alliance for the vaccine, which allows every country equal access regardless of its financial status. Otherwise, rich countries will receive the vaccine before the poor. And also Jordan today starts phase 3 vaccine on 500 volunteers, which is a good thing to do. Challenges also is the financial issue. We suffered a lot for a country like Jordan with a vulnerable financial status. We have to deal a lot with the issue, but we believe with the leadership of His Majesty the King, who is supporting us, and guiding us, we will be able to go through this hardship. Thank you.
Well, thank you to both of you and obviously also to my colleague, Joseph. Our students are reminded that we have 4 core values of service and creativity, ethics and leadership. And in so much of what I've heard from each of you is standing up at a time where deep service is required and the creativity to pivot and figure out what is needed, but most importantly, ethical leadership, to not leave the vulnerable behind, to think about challenging the international system that vaccines must be for all people. So much of what I'm hearing is a wonderful model and representation for our students and those listening of what ethical leadership looks like in practice. Thank you to both of you for taking time out of extremely busy schedules right now in this intense time that we are living through. Thank you to Joseph for partnering in this conversation. I just want to thank you for all you're doing for the people of Jordan and in the region more broadly, and for taking the time today.
شكرا جزيلا وإن شاء الله نتلاقى في جورجتاون أو في عمان.
Inshallah.
Thank you very much.
Thank you, Nicole. It's been
Thank
wonderful.
you, Nicole.
Thank you.
Thank you very much to all of you.
Bye-bye.
Thank you.
All
Bye-bye.
the best.
Thank you.
Good afternoon, everybody. I'm Evan Medeiros. I'm the Penner Family Chair in Asian Studies at the School of Foreign Service. Thanks for joining us. Thanks for watching our video today. I'm very pleased to be talking today with my friend and former colleague when I was at the NSC, Ambassador Ho Young An. Over to you, Ambassador An. Why don't you tell the audience a little bit about your background?
Well, Evan, thank you so much for inviting me to speak to Hoyas. Your students are called Hoyas. How do I know that? Because I used to be Hoya myself. I used to study.
Always a Hoya, Ambassador. Always a Hoya.
Once Hoya, always Hoya. So I used to study at the School of Foreign Service from 1981 to 83 for my MSFS. And then I kept on working for the Korean Foreign Ministry. So at a certain point, I used to be something called Deputy Foreign Minister for Trade. And then I used to be ambassador to the European Union and the Kingdom of Belgium. And then after that, I used to be something called First Vice Foreign Minister for Korea. And then after that, I came to Washington, D.C. So I used to be ambassador there from 2013 to 2017. And then at the time, I had an opportunity to work with you because you were a very high government official at the time as a senior director for Asia at the NSC. And I thoroughly enjoyed working with you. I really mean it. I thoroughly enjoyed working with you. But at the same time, at that time, then there was Michael Green and Victor Cha also teaching at the Georgetown. So, well, I feel so much close to Georgetown anyhow. So I really mean it when I say thank you so much for inviting me to speak.
Well,
to you.
we look forward to having you back as a former Hoya, but also a good friend of myself, Professor Green, Professor Cha, and we welcome the opportunity. So today's conversation is about COVID and geopolitics in Asia. And what we're trying to understand in this video series is how COVID is affecting the relationship among countries in the Asia Pacific. So let's sort of start out with your country, South Korea. How has South Korea been coping with COVID? How has it affected the daily life of Koreans? And just sort of put in context South Korea's experience.
Well, Korea has been coping with the COVID rather well. So let us just think about the numbers. The number of infection has been limited to somewhere around 15,000. And then the number of deceased has been limited to a little more than 300. So Korea has a population of 15 million. So when you think about the size of the population, then in fact, we've been dealing with COVID rather well. And just before this session, then we were talking about, say, lockdown, if there has been any period of lockdown in Korea in order to deal with COVID-19. And as I already told you, somehow we could manage without having any lockdown at all. So in a sense, we were very lucky. We were very lucky in that sense.
And what do you attribute that to? It's not just luck. What were some of the sort of policies that South Korea adopted early on that you think led to this impressive track record?
Well, as a matter of fact, they talk about 3T, how 3T has been so effective. And then 3T means testing, tracing, and treating. So testing of, well, in a sense, somebody being suspected of having been infected, and then tracing all of them backwards in order to find out where and then how they in fact were infected, and treating them. So that's what we call 3Ts. And then somehow 3Ts worked fine. But I have to tell you, beginning from a week ago, then there has been a sudden high spike in the number of infections. So today, I think it is a little more than 200. I mean, new daily infection today is a little more than 200. So there is a reason to be much concerned about it. So what we are doing is there is something called social distancing, and then there are 3 levels of social distancing. So I think it was several days ago that they just enhanced it from level 1 to level 2. So now there is a limitation on the number of people who could get together. For example, if it is indoors meeting, it cannot be more than 50. If it's outdoors meeting, it cannot be more than 100.
So that experience, is clearly very different from the United States. You were ambassador, South Korea's ambassador to the US for 4 years. You know the United States well. The US clearly has struggled, continues to struggle with COVID. How does the US response to COVID look to you, and more importantly, to policymakers and thought leaders in South Korea? Do you think that, you know, the way in which the US has struggled with COVID, is that affecting the US-South Korea relationship?
Well, I just look upon what is happening in the United States in response to COVID. And then, of course, well, all Koreans are much interested in what is happening in the United States. So I was just trying to come up with one word which would best describe how Koreans feel as they watch what is happening in the United States vis-a-vis COVID-19. And I think that one word would be bewilderment. Bewilderment would be the best one.
Interesting. Tell us about that.
How Koreans feel about how United States is responding to COVID. So, well, Evan, you just said, I know the United States well, right? And then I used to be ambassador in the United States. So there are several anecdotes that I could be sharing with you. And then anecdote one would be something you would remember. That is GHSA. You remember GHSA, Global Health Security Agenda.
Yeah.
And it was launched in January 2014. And then large number of ambassadors were invited to the launching ceremony. And then I came there, and on that day, it just happened that there was a lockdown because of snow. It was January 2014, and then there was so much snow, ambassadors couldn't make it, but I could make it. So I was there. The reason why I made a point of being there was because I really could support President Obama when he said, pandemic, epidemic, there is something which can happen for, well, whatever the reason, there is something which can happen.
That's
and
right.
Then when it happens, then there should be global coordination. That way we could respond it better. That's what President Obama said. And I strongly, well, in fact, supported when President Obama said it. So that, in fact, is the reason I was there.
And didn't South Korea then subsequently host one of the first global health security summits?
Exactly. So the first meeting was in Washington, D.C.
Of course, yeah.
And I was speaking to, I think, Andrew Bieber, who was Assistant Secretary of Defense at the time. And I asked him, who is going to host the second meeting? And he said, well, I haven't thought of it. And then I said, well, you must have the second host. Otherwise, there will be no continuity. He turned to me and then he said, how about Korea? So I said, yes, I will recommend it to Seoul. That's how it ended up that we hosted the second meeting. But anyhow, I, in fact, thought it was a very timely gesture coming from President Obama. Why? Because in a very short period of time, I think it was spring of 2014, there was outbreak of Ebola in Western Africa.
Sure.
And then the way United States responded to Ebola, I was really impressed. I mean, at the time you said something like whole of government approach.
Of course, but that was a long time ago. Where at least four
mobilized all the concerned ministries.
That's right.
You sent 3,000 medical personnel right away. And then that, in fact, made large number of countries, including South Korea, to send our own medical team to fight Ebola. So that, in fact, is one anecdote which came up in my mind.
So you said, well, let me dig into this. So you said South Koreans are bewildered. I guess the question for our audience is, South Korea is an ally. Alliances are based on commitments. Those commitments need to be credible in order to be relevant. And, in thinking about the strategic impact of that bewilderment, are we at a point in which this bewilderment, could challenge the credibility at the heart of the alliance? How serious is this bewilderment?
Well, as a matter of fact, bewilderment would be there because we have confidence in the United States. Of course, you're the richest country in the whole world. Of course, you're the country with the highest level of medical science in the whole world. So that, in fact, is the reason why with such enormous wealth, with such enormous high level of medical science, why the United States is having this much difficulty in dealing with COVID-19. So that, in fact, is the source of bewilderment.
Right.
So if you just turn around the question or turn around this observation, it should be, we in fact are confident the United States soon enough will be able to put all those problems behind you. And what I think is United States, I mean, this is something which I used to say when I used to be an ambassador in the United States. Whenever I had an opportunity to speak to a large number of audiences, this is something I always said at the time, which is that United States, in fact, is a quintessential element for global peace, stability, and prosperity. You have been that for the past 70 years. And then, as a matter of fact, much has changed from 1945 up until today. But at the same time, looking ahead, United States, in fact, can stand for that, can continue to play their role. So that, in fact, is something I kept on saying when I used to be ambassador in the United States. And then that's something I still believe in, even today.
Great. So the U.S. is one part of the equation. Another big part of the equation of COVID's effect on Asia's geopolitics is China. And then given the fact that COVID most likely emerged from within China, how do you think its origins in China has affected South Korea and South Korea's relationship with China? Could it produce some kind of fundamental change?
Well, the way China, especially during the early days, I mean, at the end of last year and then at the start of this year, China has not been very transparent. And then, as a matter of fact, transparency is not the strength of China as a nation, which reminds me of what the Prime Minister Lee Hsien Loong of Singapore says all the time. Last year, I attended the Shangri-La Dialogue in Singapore and had an opportunity to listen to him personally, I mean, at a seminar. And he had this to say, which is, well, basically he was talking about the relations between United States and China. And then what he said was that Americans, rise of China, in my view, that is inevitable. So what you should be doing, I mean, this is what Prime Minister Lee Hsien Loong said to the United States. What you should do is, you cannot keep them from emerging, but at the same time, what you can do is let them emerge in a responsible manner. I think that was a message coming from Prime Minister Lee Hsien Loong to the United States. To the Chinese, I think he had a message, very important message for the Chinese as well. What I think he said was, China, look around your neighbors. Somehow, they feel very uneasy about you emerge as a nation. Why should they feel this way? You must ask yourself why, without any exception, all of your neighbors feel very uncomfortable and uneasy about your rise as a nation. Ask yourself why they are feeling that way. And he said something, how could I say, interesting. And then if I understood him correctly, what he said was that, well, now you are emerging as a nation and try to learn from the way United States handled it. I mean, United States has been a leader of the whole world for the past 70 years. So maybe you could learn a thing or two from how you could emerge without, well, in a sense, making your neighbors feel so uneasy about it. So he said, how could I say? He went over it very quickly. I do not know how many in the audience picked it away, but I picked it a bit. So I think.
But South Korea, tell us a little bit about how you think COVID might affect South Korea's relationship with China.
Well, talking about our relationship with China, the way the question is being put to me, as well as to a large number of people in Korea these days, would be this, which is that, well, the relationship between China and United States is getting from bad to worse. And then it may keep on doing it for a long period of time to come. How should Korea respond to that? That, in fact, is a question which is often posed to me.
Well, I want to talk about the U.S.-China relationship, but before we get to that, what I was getting at, Ambassador An, is, during the COVID era, you've seen the emergence of some pretty tough public diplomacy on the Chinese part. Some people call it wolf warrior diplomacy. You've seen Chinese assertiveness in the East China Sea with Japan. at the border with India, more incidents in the South China Sea with Vietnam. And so I guess the question is do you think, you know, China's reaction, you know, some people say China's taking advantage of it. Other people are saying, no, the Chinese are just reacting defensively. Sort of, how is China's diplomacy during the COVID era, do you think it's changing the relationship with South Korea? I mean, I think just today, Xi Jinping's top diplomat, Yang Jiechi, may be arriving in Seoul for talks, and the timing seems interesting. So, just your thoughts, sort of what comes to mind.
Well, Evan, in a sense, I just told you about what Prime Minister Lee Hsien-loong is saying all the time, and I look upon Prime Minister Lee Hsien-loong as a, in a sense, a spokesperson for large number of countries, eloquent spokesperson, I have to say, for large number of countries in our region as well as around the world. So this is what you already said, in the sense that China, you are emerging as a nation, and look at your neighbors. All of them are feeling rather uneasy and very uncomfortable about your rise. Ask yourself why, and then Evan, you in fact mentioned all those cases, and then well, as a matter of fact, even without talking about all those different cases, that in fact is a huge question, big question, which has been raised by Prime Minister Lee Hsien-loong to China. And I think it's a very critical question that Chinese leaders must try to answer. And that reminds me of our good friend, Danny Russell. Yeah. And then during my time in Washington, he and I had an opportunity to attend the seminar at CSIS. And Danny, in fact, had this to say, which I thought was very thoughtful comment. What he said was that, well, people ask me about how what China is doing in South China Sea is affecting the relationship between United States and China. But as a matter of fact, the real question is a question between China today and China tomorrow. Depending upon how China behaves in South China Sea, it will definitely affect the way China is looked upon by all the other countries in the whole world. He didn't elaborate. I mean, then he simply said, it's not so much a question between United States and China, it's more a question between China today and China tomorrow. Again, it was just one single sentence. I do not know how many people picked up the meaning of it, but at the same time, I was listening to him, and that was my interpretation as I was listening to him.
Well, so let me look a little bit broader than China to how COVID's affecting South Korea's foreign policy in the region. And, you know, in particular, what comes to mind is the issue of the future of the Korean Peninsula and negotiations with the North. And so, you know, how do you see COVID affecting North-South relations, right? There's lots of pretty credible evidence that COVID has had a fairly devastating impact on North Korea. And also, you know, South Korea's position in Asia more broadly, right? It's one of the few economies in Asia that have managed exceptionally well under COVID. Does that give South Korea a platform from which to become more of a leader in regional politics?
We're talking about North Korea, then of course, it in fact is having enormous difficulty because of something called sanctions, UN sanctions, as well as national sanctions. And North Korea cannot escape from those sanctions because of its obsession with nuclear weapons. So that, in fact, is the single biggest problem for North Korea as a regime. And then on top of it, then there was COVID, because of which it, in fact, literally had to close down all of its national border between North Korea and China, which in fact is exacerbating the economic condition in North Korea. And then this year, in our part of the world, not only North Korea, but also in China, South Korea, North Korea, Japan, we had huge flooding issue. There was huge rain. And then that, if it was difficult for Korea, you could only imagine how much more difficult it will be for North Korea.
Sure.
So we can imagine that North Korea is an enormous economic difficulty. And I very much hope that North Korea could be taking this as a kind of opportunity to think fundamentally about the way it thinks about this relationship between, say, national security and then economy. In the sense that national security, well, having weapons of mass destruction, it doesn't increase your security. That's something North Korea must understand. But at the same time, talking about South Korea, Evan, you said, well, in terms of economy, South Korea couldn't manage rather well. And then I have to tell you, in Q2, second quarter, then Korean economy grew minus 3%. That is to say, it didn't grow at all. It grew minus 3%.
Right, it shrunk.
But, yeah, it shrunk by 3%. But at the same time, what I read is that the OECD came up with its, in a sense, analysis of how this COVID-19 is affecting economies, especially OECD economies in the whole world. And then what OECD is telling us is, well, minus 3%, that is the best performance. I'm really surprised about that.
Yeah, the Chinese economy shrunk about 6% in the second quarter, right? Yeah, so, no, I'm sorry, in the first quarter.
And then China, of course, is not a member of OECD. So OECD said, well, minus 3%. It shrunk, but at the same time, not as badly as in other OECD economies. But at the same time, looking inside Korean economy, looking inside Korean society, then of course there is a huge number of difficulties, especially restaurants, travel business, and accommodation, education, and then all of them are suffering very badly, and the number of unemployment is going up. So this, in fact, is a very difficult time, which leads me to in fact think about all these parallels being drawn between 1918, what happened in Europe, and globally in the aftermath of something called Spanish influenza. And then that, in fact, just coincided with the end of World War I. And this into a period between 1919 and 1939. And then that, in fact, was the period when we saw the emergence of totalitarianism, authoritarianism, Nazism, etc., etc. So I think concern is being expressed that the way we are responding to COVID-19, it in fact could be, in a sense, be abused as an opportunity for somebody, some politicians who in fact think in terms of using more coercive power as a government. And then that, I think, is a real threat. If you think about history, if you think about, in a sense, the usual way human beings behave to enormous difficulty, I think that, in fact, is something about which we should be concerned about.
So I want to follow up on that. So in that context, you have a South Korea who its economy obviously shrunk, but did in relative terms better than most other OECD economies. South Korea is managing the virus far better than others. Does this provide an opportunity for Korea to begin positioning itself as a leader on global health and other issues as a result of COVID? Is this a strategic opportunity for South Korea?
Well, Evan, is very interesting because that was something I was moving to, in the sense that, there is one subject I often think about, which is globalization. And then the relationship between Korea and globalization is a very interesting relationship in my mind, because globalization, in fact, has been imposed from top down in Korea. In the Korean context, I think Korea would be one of the few countries where President declared globalization is something we must adopt. That was President Kim Il-sung back in 1994. And at the time, I used to be something called Director for International Trade. And then I, in fact, was co-opted in the task force, in fact, in order to implement what President declared. So I have this clear, memory of what President Kim Il-sung tried to do at the time. But at the same time, that declaration of the President, it received very strong, positive reception from the Korean society. And I think Korea has been a very faithful implementer of globalization so far during the past 30 years. And I think President Lee Myung-bak, he in fact, his political slogan was Global Korea, and he tried to implement it, not only declaring it, but to implement it. And all along, during that period of time, I used to be in the Korean Foreign Service as a diplomat. And I personally believed in the way Korea should be moving to, which is that Korea, because of many different reasons, because of geopolitics, because of geoeconomics, Korea, in fact, is a huge beneficiary of globalization. And I just look upon what is happening in the whole world, beginning from 2008, 2011, 2016. I think globalization is suffering rather badly. Protectionism is spreading,
Sure.
multilateralism is suffering, and then along the way, all those political values we strongly believe in, like freedom, democracy, human rights, they are suffering as well. So I'm concerned. So COVID-19 is having its impact upon the way domestic politics are being managed, but at the same time, it is having impact upon interstate relationship. So I think there should be awakening in the United States, in Korea, all over the world, what damage, in fact, COVID-19 could be bringing. Mm-hmm. And then not only awakening, but also in a sense, tangible efforts we should be making to make sure that they wouldn't happen.
Interesting. So let me ask you our final question, which is about the US-China relationship. And tensions have clearly been rising due to COVID, but there are plenty of other issues as well. Xinjiang, Hong Kong, Taiwan, questions of technology and technology transfer. So as South Korea looks at this rising tensions, the fact that South Korea is sort of, in the middle of this, as are many countries, how would you say policymakers, scholars, even business leaders in South Korea look at these rising tensions in the US-China relationship? President Trump has taken a pretty hard-lined approach to China. Is this something that's seen as welcome, necessary, excessive, risky, warmongering? Sort of, how does South Korea look at the US-China relationship?
Well, as I said a couple of minutes ago, a large number of people pose the same question to me all the time here in Seoul. And then I try to make 2 points when that question is being posed to me. My first point is this, which is that, let us think about Korean economy. Let us think about Korean security. Well, as a matter of fact, there are countries called Quad in Korea. And then when I say Quad, that refers to United States, Japan, China, and Russia. And they are the 4 countries which, in fact, play very important role in managing the regional as well as global relationship in our part of the world. So my first point is, we're thinking about geopolitics, thinking about geoeconomics. There is no other option for Korea than, in fact, try to manage the best possible relationship with all the four Quad countries. That is number one. Number two is this, which is, if our bilateral relationship with Quad, if all of them can develop in a positive way, then that's great. That will be an ideal world. But at the same time, we do not live in an ideal world. We live in a real world. In the real world, there can be conflict between our bilateral relationship with one Quad country. In fact, could conflict with our bilateral relationship with another Quad country. When it happens, then we must keep in mind about 2 facts, 2 basic elements, which is the basic values upon which South Korea is built up. Freedom, democracy, human rights. Well, if we have to make a choice, then we have to make a choice in a way which could be best preserving freedom, democracy, and human rights. Second point, the basis of our national security. Let us just think about very, very coolly about what in fact is absolutely necessary in order to maintain our national security. So in the real world, there can be conflict in our best relationship with Quad countries, with another Quad country. So there can be conflict in the real world. When this conflict arises, then we must think about these 2 basic elements. One, upon what our country is built, freedom, democracy, and human rights, to what in fact is a quintessential element to maintain our national security. Without national security, the nation cannot survive. So
well, that's wonderful. Ambassador An, that's a great point to end on. On behalf of Georgetown and all of the Hoyas, we'd like to thank you for spending your time with us today, sharing your insights about South Korea's response to COVID. As a lifetime Hoya, we hope that you'll, once America opens up again, we hope that you'll come and visit us and share your latest insights on how Asian geopolitics are emerging in the post-COVID era. So, Ambassador An, thank you very much.
Thank you so much, and all the best.
Good afternoon, everybody. I'm Evan Medeiros. I'm the Penner Family Chair in Asian Studies at Georgetown University. And today I'm very pleased to have one of my former colleagues and longtime friends, Ken Sasae, join us today to help us better understand the Japanese perspective on COVID and how it's affected Japan's foreign policy in Asia. So Ken, maybe you could begin by introducing yourself and tell us a little bit about your background.
Okay. Well, good morning, everyone, and thank you, Evan, for having me on this program. My name is Ken Sasae. I am a diplomat, and I have been working for Japanese Foreign Service over 40 years. It's incredible. But over these years, I basically worked on Asian, American, and trade issues. I worked with many government officials of the United States over the years, so including Evan Medeiros, and I had a good working relationship under Obama presidency with him, and so 2 years back I retired and from the Foreign Service. I'm now working as a president of Japan Institute for International Affairs, which is known globally, hopefully, and Pennsylvania global ranking tells that it's 13th, ranking, and so I'm proud of that. I'm really enjoying the work now.
Great. Well, Ken, we wanted to invite you because of your background as both the president of the Japan Institute of International Affairs, but of course, as part of your longtime career, you know America, you know Asia. And first and foremost, we would like to hear your perspectives on how Japan has been coping with COVID, how it's affected your daily life, the lives of the members of your family, and sort of understand how Japan as a country is coping.
Okay. Well, if you look at the Japanese situation, the situation is relatively, I would say, moderate in terms of the impact of this coronavirus, say, compared to some European countries and India, Brazil, and the United States. I mean, the number of cases affected is in the order of 59,000. It's not a big size compared to the population, and the number of deaths is 1,100. So, but still, in Japanese, standard, it's a huge problem, especially in the city area like Tokyo, where I live now. The daily, we thought that it was more or less contained, but now as we reopen the economy, the virus is now coming back for the third. So daily 200 and 300 cases we see, but the cumulative deaths in Tokyo is 350. So,
and how about the effect on Japanese politics, the Japanese economy? Is it the dominant issue for Japan right now, like it is in the United States?
Yeah. And the impact on the economy is severe, of course. I mean, not only in terms of gross national, products and so forth. It's the same as everywhere. And people are are very much worried that they are especially the service industries. People don't go out and eat and travel. So government is now trying to advise the people to go for traveling with tremendous cautions on the coronavirus. But basically, people are very much following the government guidance and discipline, all the social distancing, masking, and so forth. But when it comes to the economy, I think that the economists predict that this could be lasting long for another year, 2, or even 3 years before we come back to the situation, before the coronavirus took place. Mm-hmm. So, and politically, there is some, criticism against the way the Abe administration is now handling. And one, I think there isn't sufficient PCR testing, and the action is not necessarily quick enough, and so forth. But on the whole, I think the coronavirus itself is not directly hitting and this politics as we see possibly in the United States, say, the impact of coronavirus.
Well, that's where I'd like to go. So it's moderate in Japan, economic dislocation. It hasn't destabilized politics. But the United States, the situation here is very different. So how does the U.S. response to COVID look to you? You've lived in the United States many different times. Of course, you were ambassador for many years.
Yeah. Right.
Has the U.S. experience with COVID affected your views of the United States? Would you say the Japanese government's views?
Yeah.
What do you expect for the United States over the long term because of COVID?
Yeah. First of all, I think the situation in the United States is very dynamic and messy, I would say. All this, the size of the deaths and so forth is staggering. And there is an enormous divide between the scientists and the economic, economists, and between the president and the science advisors and so forth. And also the situation among the states are different, and people are even debating whether you should put on a mask and so forth. So, it's a kind of sad for us to see that the United States is still grappling with a fundamental how we would cope with the coronavirus. So for Japanese people, I mean, there is a very much interest on the American politics, to be honest, including the South leaders in political leadership. And but would the United States continue to be faced with this problem? I think my hunch is that it might be taking longer, but one day it will be coming back. America has the strength to overcome these challenges anyway. And, the divide and the confrontation in the United States was there even before coronavirus took place. So this was exacerbated by the way the policy was implemented over. And but as I said, Americans possibly after some confusion will be coming back.
So this doesn't test your fundamental assumptions about American strength, of course, the U.S.-Japan alliance. This hasn't challenged those views.
Yeah, of course there is a challenge, but when I'm asked that, I have a worry about the America coming back. I don't have that. America has a fundamental strength to cope with this one. For the moment, there is a confusion and confrontation, and there are lots of concerns about Americans' handling of global issues, including issue of global governance and nuclear order, and also how you would cope with the Chinese challenges and so forth. But when it comes to Americans' fundamental power to follow through the democracy so forth, we still have the confidence, including the majority of Japanese people. That's different from some of the views on the Trump presidency and whether Joe Biden would completely reverse and change the course and so forth. That's a different issues to us.
Sure.
This is more of our faith and confidence about American power, American capacity to come back.
Sure. Well, I'm glad that you mentioned China because obviously COVID most likely emerged from within China. So how has the origins in China affected you in your country, how you think about China, respond to the China challenge? Of course, before COVID, Prime Minister Abe and Xi Jinping were planning a state visit in April of this year, which, seems very, very distant now. Do you think COVID will fundamentally change how you think about China and how Japan relates to China?
Well, the fundamentally, that is not changing, possibly. I mean that, of course, we had a tremendous concern over the origins of this coronavirus, Wuhan, and there was a problem of policy transparency, and also there is some Chinese model over which we have concern. I mean, they were quick enough to control the situation by state means, but at the same time, this was the strengthening of government control over the individual freedom and so forth. So there is the dual aspect of China. When it comes to our relationship with China, yes, the Xi Jinping's visit was postponed for the obvious reason. He can't come simply because of this coronavirus situations. And also during that time, there was continued Chinese advancement into East China Sea, West, South China Sea, and it's Hong Kong and Taiwan and all the things. And so there was the impression given that China was taking advantage of some of the, problem we have. And they're also trying to expand the influence into the ASEAN and other Asian countries.
So do you think it's likely that the state visit will just be canceled or perhaps indefinitely postponed?
Well, that's still too early to say, because I don't think that will be indefinitely postponed, and hardly we would be settling on this coronavirus, and there is a situation when the Chinese were ready to address all these difficult questions and issues we have to confront, and then I don't think the Japanese government is totally shutting down the possibility of having a state-level dialogue.
Do you think the Chinese used COVID, took advantage of everybody's preoccupation to make these advancements in the East China Sea? I mean, you worked on this issue many different times.
Yeah. To some extent, the answer is yes, I think. For example, American, the military presence and all this, coronavirus affected, for example, American, aircraft carrier and so forth. And also, whenever they say that there is some problems and confusion in domestic politics, they try to take advantage of that. That is not necessarily new to all of us. So I think that they try to take an advantage and also test the intentions and nerves of the countries around them. And so we continue to be cautious and guarded against their own actions to take advantage of the situation.
And beyond China, How do you think COVID has affected Japanese foreign policy in the region? Do you think Asian geopolitics are going to substantially change because of COVID? Obviously, you've got examples of two countries, two democracies, South Korea and Taiwan, that have emerged, that reacted quite well to this. Do you think that we're going to see a reordering in regional politics because of COVID?
Yeah. I think this is a kind of continuations of the Chinese expansions of influence and power in the region, and COVID accelerated that trend. I would define that way. And so, for example, ASEAN's, on the one hand, they try to be more vocal about Chinese intrusion into their own water and all these fishery problems and so forth. On the other hand, they continue to recognize their dependence upon Chinese economic power and the market and trade. And that also applied to other countries in the region, including Australia and even India and even Japan, one way or another. We can't totally neglect the Chinese economic presence and impact on.
So your view is COVID's going to be an opportunity for China to accelerate the expansion of its economic and political power. Why is that?
Yeah. What? Sorry.
Why?
I didn't. Well, I think that's their policy. I mean, it's a continued long-term policy. They want to they want to be a big country and global power, like the United States. Whether there is a COVID or not, I think this is a continued ambitions of China. I mean, so
I very much agree. But the issue with COVID is COVID has created a lot of concern throughout Asia and throughout the world about China. Yeah. It's sort of reignited concerns about a rising China. And of course, some of China's diplomacy has been, very aggressive. People now talk about wolf warrior diplomacy. Yeah. So I guess my question is do you think Asia has been reacting to that in a way that hurts China or helps China?
I think that's both, I would say still. Of course, I think there is more concern and alert, especially on the part of Chinese motivation to influence their own domestic politics, and also even diplomacy and national security part. But at the same time, this also worked in a way to impress upon the business people and general public that they continue to be dependent upon China, including possibly this dealing with the coronavirus.
Right, sure. That makes a lot of sense. So the last question today is about the U.S.-China relationship. Tensions are steadily rising due to COVID, but also other issues, Hong Kong, Taiwan, technology. So how do policymakers, scholars, even business leaders in Japan look at the recent increase in tensions, look at Trump's tougher approach to China? Is it viewed as welcome, necessary, excessive, too risky? How does Japan think about the U.S.-China relationship?
I think there are divided views, I would say, in Japan, especially finding how you would evaluate the Trump approach to China. And on the one hand, there are national security people who welcome these tough positions because they believe that China is not listening and to ideal sort of preaching and how that China should be doing and so forth. And they only listen to the words supported by the actions and power of the authority. So this show of American strength in more traditional hegemonic terms is good. And for that, I think whether it is cyber issues or Chinese suppression of democracy and so forth. And this has to be accompanied by the specific action. Oh, of course, there is even criticism that even Trump administration is not doing good enough. So these people basically welcome all this tough policy. This was long overdue. But at the same time, people don't appreciate the United States will be having a serious confrontation, and so that they have to go into the war. And this is not something we don't want to see either. So there is some balance between being tough and also being tactful enough and not to be engaged in the war. And for that, I think, especially the business point of view, and they continue to depend on Chinese market on the sort. And that this is a reality. We can't completely shut down, the dealing with China on the economic and transactions. But at the same time, we have to recognize that China is using all this economic, relationship for the security and other strategic leverage.
So Japan, that's a very important point, Ken. Japan's economy is almost as interdependent with China as the American economy, right? China is an important source of exports, investment. So China policy has to be a balance. How does Japan think about balancing economic and security interests? And how does Japan think America should balance economic and security interests?
I think you have to define the area where there should be a more emphasis on the security component. And that is especially on the high tech and the strategic industries, space and all these high tech related industries. And you can't really depend upon China. I think that's getting more support, even from the business leaders. But at the same time, when you try to completely contain embargoes, for example, China for various, other economic fields, then people don't think that that's wide enough. So there is an area where you have to pay more attention, emphasis on the security component. You have to be careful. But other things, it's not wise to completely shut down, and even you can't do it.
Right. Interesting. Well, Ken Sasae, thank you very much. We appreciate you sharing your perspectives with us today. Thank you.
What a rich and diverse set of conversations. Let me highlight a few threads that ran through the different conversations we've had. There are existing challenges that have been exacerbated by the COVID-19 crisis. State weakness, fragile social contracts, inequality for gender, indigenous, vulnerable populations, and economic challenges have all been exacerbated and made worse during this time of the pandemic. We see the impact of COVID on other issues, democracy in Chile and throughout Latin America, where people who would like to be engaged in social justice protests and advocacy are no longer able to. Economic development in Jordan. The displacement of medical care for other diseases, as was highlighted by Her Royal Highness. These are all key issues that we need to explore as we think about not only the health impact of the global pandemic, but truly the broader ramifications by region and globally that the pandemic is having throughout the world. I hope you have a rich discussion about these three fascinating interviews.